So I am here with Dr. Angie Sadeghi. Did I pronounce that correct?
That is correct. Yes.
Thank you so much for your time on coming on. I've been following you for a good while and I love the work that you're doing. So I'm really looking forward to talking with you.
Well, thank you so much. I'm excited to be here.
Yeah. And we were just talking a little bit off camera before about this coronavirus thing. How's everything in California? What have you heard about this so far as a medical doctor, and where do you see it going, if I may ask?
Well, every time we have a pandemic like this, it's interesting because people freak out and they talk about it. Our economy changes, nearly collapses, and everything, you know, um, uh, is a mess right now. As you can see, people are losing their jobs, people are dying in the hospitals, and so everyone keeps talking about it, and then literally, like after a little short while, it just like dies out and no one's interested anymore, no one's talking about it anymore. And so that's what bothers me the most, because um, things like this happen and nobody learns a lesson, right? So imagine how many people died worldwide. Thousands, right? How many people suffered with the disease? Thousands. And how many people lost their jobs because of what happened? Thousands. We're going to hit a recession, right? And what bothers me that is that in a couple of months, when everything goes back to sort of quote unquote normal, people will forget where this virus came from in the first place. And if we don't learn our lesson, this is going to keep happening. It bothers me that we live in a world that people don't think beyond the urgency that's happening at that time. No one thinks about preventing diseases. This is a zoonotic disease. It comes from animals. And as long as we have the animal agriculture and we have these disgusting wet markets, we're going to have this problem over and over again. And there is no end to it. I mean, we had SARS, we've had, I mean, think about salmonella. Every year it kills people. That comes from poultry. Think about E. coli that kills people. That comes from red meat, from the cows. Think about SARS that we dealt with just recently, not too long ago. Think about the influenza virus. I mean, all of these diseases are coming from the consumption of meat, dairy, and eggs. And so I'm hoping and I'm praying, hoping, begging people, please learn your lesson. This is the time for us to stop eating animals. This is the time that we stop contributing to animal agriculture. This is the time that we shut down these wet markets. And this is the time that we start eating a whole food plant-based diet, which is healthier. It does not contribute to these types of pandemics. And it's so much more ethical and it's so much better for the environment.
Absolutely. Yeah. I mean, you nailed it there. I think that, people are not making the connection where this all originated from. And, you know, it led from someone eating an animal and then them catching it and spreading it to the world. I think the media is definitely hyping it up and putting a real focus on it. And it is a concern for many, like especially the elderly or anyone whose immune system is suppressed. But ultimately, yeah, you're right. The way society is gonna go back, and they'll forget about where it ultimately came from, and it'll keep on going. Um, I'm more scared of the economic aspect of things because that creates panic. And I'm not just thinking about the health consequences, but also society and how it's going to function. And will it lead to more violence and just society breaking apart? And I'm not trying to like create a conspiracy theory or anything, but you see these videos from online of people in grocery stores fighting over just toilet paper or bread, and it's really sad. um but what can you do? I mean, I think, and you look at it differently. Why haven't we put so much focus and panic around heart disease, for example, the leading cause of death? I mean, I'm sure you're frustrated as well about that, and diabetes and certain forms of cancers. Why are we not panicking? Because the death toll is much worse with those, wouldn't you say?
Oh, absolutely. Heart disease is um, it kills millions of people around the world every day, and no one panics. I think that's just psychology, human psychology, right? What we do is we have the fear of the unknown. So, heart disease is like accepted, right? We're supposed to die of heart disease. I mean, this is what people think, and they go on and they don't like it. Doesn't scare them. What scares people is something that comes on suddenly and it wipes out the population. And it literally just is unknown. It's new, and it could have been completely preventable. These are things that really freak people out. I'm not saying that's right or wrong. I think you're right in that we should be freaking out more about heart disease because it kills more people. And if you think about it, at some point, everyone is going to be infected with the coronavirus. You cannot prevent it. It is going to be, it's going to be the next the flu virus. It's just going to keep coming back because when these things come out, it's almost impossible to stop them anymore. It's just going to go, and it's just going to be the survival of the fittest. And if you're not fit, you're not going to make it. If you're fit, you're going to make it. Okay. And sometimes it's interesting because there are some people who are super fit and super healthy, never smoked, didn't drink. They're like, a lot of doctors are dying from the disease, and they're, I know someone who died who's 55 years old. He's not old. He was fit and he worked out, all of that stuff. So, you're right. I mean, I don't think that we should forget that heart disease is the number one killer. But this disease is causing a lot of economic turmoil. And whereas heart disease is not contagious, this disease is contagious. So we have to take it seriously. We've got to shut things down, businesses down. We've got to keep people inside to stop the spread. And that has grave consequences economically, right? People are going to lose their jobs. Most people are going to go out of business. I personally have to lay people off at my practice. I mean, it's not a joke, right? So we have to take this seriously, even though it may not kill as many people as heart disease. We have to take it seriously because it is serious. But interestingly, like what we were talking about, both causes are basically so heart disease is in this country, it's due to diet mostly, right? And you think about these diseases like the Spanish flu, like SARS, like the coronavirus, again, from the animals and the animal agriculture and the wet market. So you see that all of it is, and I'm not trying to oversimplify it because it's very complicated, but at the end of the day, there is a common cause here. And I think we need to, as a society, we need to recognize that. And this is the perfect opportunity to clean up our act and, figure out a way to step away from our old cultural habits that are not necessarily right, but it's just their habits. And we keep repeating these habits. For example, when you have a gathering and the centerpiece of your plate is a piece of chicken or beef, we need to step away from these practices, even though we're culturally attached to them. We just have to find new ways to live because what we're doing right now is not working.
Right. Yeah. I couldn't have said that better. And it's something we'll definitely all of us have to keep an eye on and hope for the best that things do get better. And I'm sorry to throw that at you. Like first thing in the interview, it's like, it's like on everyone's mind. So I appreciate your thoughts.
My
But
pleasure.
but Dr. Sadeghi, tell me, let's go back, let's focus on the work that you do. How did you first get into medicine and gastroenterology?
When I was 9 years old, I wanted to become a physician. Growing up, my father was very encouraging that I become a strong, independent woman, and he's always taught me that. And he's always helped me understand that in many parts of the world, women don't have equal rights. So he kind of raised me as a little bit of a feminist and made me understand that there's inequality and that I could possibly be a big force and I could make changes in this world, and that I should really um, nurture. I mean, he noticed that I'm very kind of academically. I was doing, I would do well, right? And he always said, you're gonna do something big with your life one day. I know it, and he kept encouraging that. One day at 9 years old, I had watched a movie about Madame Curie, and he made sure of that. He made sure that I watched the documentary about Madame Curie, who was a physicist who did research, and so I saw this documentary and I was so impressed by her. And as a 9-year-old, I was thinking, man, that would be so cool to be a scientist or a doctor, and help save lives. And then I had gone to a doctor's appointment, and I remember this ophthalmologist came out and with the white coat, and I was like, that looks good. I would love to be able to do that. So on the way back from the ophthalmology appointment, I told my mom and dad, I said, I think I want to be a doctor. And my dad was super happy about that. And so, yeah, since then, I just always, every single day of my life, I wanted to be a doctor. It never changed. I had my compelling vision that I had in my brain, and I just kind of kept going towards that goal. And yeah, I just after college went to med school, and after med school, I just kept like falling in love with it even more and more. I mean, as I've been a doctor for now real practice for about 15 years, and every day I'm thankful that God or the universe, whoever you believe in, has led me to this career, because I just absolutely love it.
Wow, that's amazing. That goes so far back at 9 years old. I think myself at 9 years old, I was playing like video games and watching SpongeBob. I wasn't even thinking that. So that's amazing. You were like thinking that far ahead, and you kind of had a little bit of a vision. Um, what made you, I guess, want to go into specifically with gastroenterology? Was there something that caught your interest while you were in school?
Well, gastroenterology is like a combination of procedures as well as cognitive thinking, because we're all internists. All gastroenterologists are also internists, so we just subspecialize in GI. And so, as an internist, I've always liked to put the whole body together and understand the internal, like molecular cell biology and chemistry and the physiology and anatomy, and like put everything together and have a deep understanding of the human body. And then when it came to subspecialty, I thought about nephrology, which is the study of the kidneys, and I thought about cardiology. And I think at the end of the day, when it came to narrowing it down, I'm very good with my hands, and I could have been a surgeon. And so I thought, if I go into GI, it's a combination of cognitive thinking as well as using my hands, because I'm good with procedures. So I do procedures, non-invasive endoscopies and colonoscopies. So, it was just the perfect fit for my personality. And also, later on, not knowing this at the time, later on, I fell into the nutritional aspects of it. And nutrition sparked my interest. And I mean, what better field to be in when you love nutrition? I just got
Absolutely.
really lucky there.
Yeah, for sure. I watched Forks Over Knives. I'm sure you've seen it and heard about it.
Oh,
Um,
yes. It
yeah,
changed my life.
mine too. As soon as I watched that, I changed from an astronomy major to a nutritionist. I went down the nutrition path because of that
Wow.
film. And I
Yeah.
just like changed, like, I was making steps like in my personal life, like getting rid of animal products, went vegan, and wanted to tell everyone about it. So that's why I chose that career path. But
That's
um,
awesome. How old were you?
oh gosh, it was like, I was actually 21, 21 years old, and you think I'd be
That's
out partying and
awesome.
drinking?
Yeah.
Yeah,
You were watching Forks Over Knives as a 21-year-old? That's pretty cool.
crazy, right? And then I gave up like alcohol. Like I had my last drink ever was like with my favorite singer. I bought him a beer, and like, yeah, I just like, I everything was like changing around me. I was trying to make better changes for myself, and at 21, yeah, it's kind of crazy to put that in perspective, but
Yeah.
yeah, so that film was amazing, and I've connected with all those doctors. I was just so moved.
So did you go vegan overnight?
No, so my parents are from Greece, and we we have 40 days of Lent before Easter,
Uh-huh.
which
Yes.
means essentially going vegan. It's giving up all animal products. even
Yes.
oils sometimes.
Right.
So what I was like, I'd never done that before for the whole 40 days. So I was like, why not try it? You know, I'll give it a shot, whatever. I just watched this film, like it all makes sense. This is a perfect test trial. So I did that. And when it came to Easter, everyone was having lamb. I decided to keep on going. And that's how
I love
everything
that.
kind
That's
of
such a good
started.
story.
Yeah.
Yeah.
Yeah. So,
Now
um,
that I think about it, you do look Greek. I was there last year in August. What a beautiful country.
oh, you went? What part?
Well, I first of all I went to Milos, which was heavenly,
Mm-hmm.
and then Santorini, and
Yeah.
then Athens. And I found so many vegan restaurants in Athens. They have, you know, there is no deficiency of that at all.
Right. They have a good bit, and they always have, like, fresh vegetables and,
Oh yes.
like, whole grain pasta and all sorts of stuff that you can even get at, like, other restaurants too. So that's awesome. I'm glad you went and had a great time.
Oh yes, yeah, for sure. Greece is a really beautiful country.
Yeah. So I wanted to ask you, how did you stumble upon the vegan thing, and how did you get on that?
Yeah, I love animals, like purely, it was purely ethical. And about 15 years ago, I realized that the meat I was eating was a real animal at some point. And I made that connection that this meat was the part of the flesh of some animal um, who is no different than my dog, essentially. And I realized that I was being a speciesist, saying it's okay to kill, torture, inflict pain upon this cow that I'm eating, but my dog should be treated like a princess and a human being. So I was like, this doesn't make sense, and I realized, when you have a pet, you realize how much feeling they have, how much they want to live, and how much they don't want to be tortured and killed, and all of that stuff. And you realize how similar animals are to us, and how much they love their young and they care for their babies just like we do, and how much they love affection. And so I was like, wow, I always thought that these animals should be bred for us to torture and kill, and that's okay. And I instantaneously thought that was wrong. But I kept on eating dairy products and eggs because I really honestly did not know the cruelty in association with the dairy industry. I realized that they're actually worse than the meat industry. I didn't know that. So I kept drinking milk and eating cheese, and I really, really, really terrible pustular eczema and skin reaction that looks like herpes all over your body. Yeah, super hot, right? I had that. And I didn't know it's because of eating dairy. I'm highly allergic to it. So is everyone else. I mean, like, people should not be eating dairy, but we have these different things that happen to us. We just don't know what's happening. Um, so I kept on eating all that stuff. And then 6 years ago, I was at a seminar, and the speaker said something about, well, if you're trying to lose weight and be healthy, why would you be eating baby calf growth fluid? This doesn't make sense. And then that same day, my cousin, who's a vegan, said, you should watch Forks Over Knives. As a doctor, you should know what's going on. And I watched Forks Over Knives, and literally that night, my life changed.
Yeah, yours too, it sounds like. That's yeah, that
Yes.
that is a powerful film. For
Yes.
me, it was the health aspect first that I had connected with, I guess just because a lot of things were going on in my life at that point, and everything made sense to make positive changes. But I watched Earthlings a little while after that, and I don't, have you seen Earthlings?
Yes.
It's
That's the vegan
powerful,
makeup.
and yeah, that's what like ultimately made me make the connection with the whole animal cruelty aspect of things.
That's
It
right.
wasn't
That's a
just about
wonderful
eating.
film.
Yeah, absolutely. Can't recommend it enough. It wasn't just about eating plant-based at that point just for my health. It was about just everything, putting everything into perspective. So,
Yeah.
that's amazing. And you just kind of realized that at that point it made sense with your career as well, like to promote this with your patients.
Yes, because I mean, if you believe in something so strongly, and like my life changed and I became so much healthier, right? And I realized, and I lost weight, I lost my unwanted weight, my cholesterol went down, and my eczema went away. And I realized, wow, this is beyond my moral values. As a physician in the clinic, people are not paying me to come and hear my moral values. They are there to get help, to be healthier. So I don't like to, push my values on people in the clinic. My job is to be a doctor and to help prevent and reverse disease and treat disease. So, but once I really learned about all the health benefits of veganism, then I just couldn't help it. I realized, wow, this is healthy. I'm gonna help my patients truly get to the root cause of their disease, and I'm helping the animals. It is a no-brainer. I need to merge a plant-based nutrition and integrate it into my GI practice, and it just helps me become that much more of a powerful doctor.
Yeah, absolutely. It's great, and I'm sure it's very fulfilling for you to not have to go against your values, but also knowing that you're helping the other person as well.
For sure. I mean, ultimately, it's about helping people, and I can, and that's what I'm doing every day. And you're right. I'm not even going against my values. It's something I'm totally passionate in many ways. And I'm, again, like, this is why so 6 years ago, I had another, um, like, light bulb turn in my head, thinking, man, I did the right thing. Like, 9 years old, here I am wanting to become a doctor, and it just keeps evolving, and it keeps getting better and better, and I'm so glad that now I can integrate plant-based nutrition into it to help the animals, to help people reverse disease. It's just all come together.
Yeah, yeah, that's really cool. Yeah, I kind of want to get into the work that you do now. So a lot of your work is working with the GI tract. So you know, to say it as bluntly as possible, from mouth to anus, all the problems that are in between. So I kind of written a couple of these problems down, and these are some of the stuff that I've seen with patients as well. People send me questions about this stuff as well. So I was wondering if we could go through kind of each one, and maybe the solution is the same for most or all of them. But if you can kind of like give your take on what might be the cause of each one and what might help
Oh,
each
sure,
one.
absolutely. Good idea.
Yeah, so I would say maybe starting off with GERD first. It's right in the esophagus, so very early in the GI tract. It's reflux. It could be painful. It's also known as heartburn. What are your thoughts on it, and what have you found that helps?
Yeah, so gastroesophageal reflux disease is a disease where the contents of the acid and the or bile or the contents of the stomach, called the refluxate, comes up into the esophagus and injures the esophagus. And um, so the esophagus, after you swallow food, the esophagus transfers that food bolus, in this tiny tube into into the stomach. The stomach is where the food sits for like several hours, and acid gets mixed up into it, and then it becomes soft, and then slowly gets passed into the duodenum for absorption and further digestion. So at the bottom of the lower esophagus, right before we enter the stomach, there is a sphincter called the lower esophageal sphincter. This sphincter it's like a muscle, and it's supposed to stay kind of tight. So when you eat, the nervous system orders the sphincter to relax, to allow the food bolus to go down into the stomach. But then shortly thereafter, it's supposed to be tight and squeezed again, so the food content and the acid that's already in the stomach doesn't back up into the esophagus. It's supposed to be a one-way road, and that's the healthy way. Um, if that sphincter relaxes, the content comes up and backs up into the esophagus. Whereas the stomach mucosa is well equipped to handle enzymes and acid and bile, the esophageal mucosa is not well equipped to handle that. Imagine your car, whereas the outside of the car is well equipped to handle rain, snow, ice, wind. The inside of your car is not well equipped to handle that. If you had a convertible and you decided to drive around in the rain, the inside of it will just get ruined, right? So it's the same thing with the esophagus. The esophagus, imagine, is basically it's just supposed to push the food down into the stomach, and it cannot handle acid. It cannot handle bile. It cannot handle the refluxate. And the reason is that they're two completely different types of tissues. The mucosa in the stomach is basically has a mucus layer inside of on top of it, and it's very robust and strong, and it can handle that acid. So anyhow, so this refluxate goes up into the esophagus and it causes esophagitis, inflammation of the esophagus. And then after a while, you get transformation of the esophageal mucosa to something that you would find in the gastric region, because the esophagus is like, what the heck is going on? This is not the right type of environment. I'm going to be more like the stomach. So then what happens is that's called Barrett's esophagus, where it just gets transformed into this stomach type mucosa. And that Barrett's esophagus is high risk for, is a risk factor for esophageal cancer. Okay. So bottom line is the food that we eat should go down the esophagus, stay in the stomach, and not come back up. And so then you think, all right, well, then how do you treat gastroesophageal reflux disease? Well, unfortunately, in this country, we're very well focused on how to treat it with pills, right? There's H2 blockers like Zantac and Pepcid, and ranitidine and things like that. And then there's PPIs like Prilosec, omeprazole, esomeprazole, Asafax, blah, blah. Like there are so many different types. There's about 10 to 15 over-the-counter medicines out there to treat acid reflux. And what that does, the focus is to basically cut down the acid. And when you cut down the acid, what happens is you get relief of the symptoms. You have like heartburn, like chest pain, like sore throat, your tongue burning, feeling of globus, like something stuck in your throat. All of that stuff gets better. But unfortunately, all of that stuff is not like you're not preventing reflux. It's just basically you're cutting down the acid, right? And it's not healthy to take these medicines because they have long-term ramifications. So then the question is, well, then what else can you do? Okay. The answer is lifestyle modifications. When you have acid reflux, the best thing to do is to prevent this from happening. And then it goes to the importance of that sphincter at the bottom of the esophagus, which is the gatekeeper, right? To keep the contents in the stomach from coming back up. They've done some studies where they've found that there are several factors that contribute to the relaxation of the lower esophageal sphincter. One of them is the fatty foods, okay? And I'm not talking about eating an avocado and a few nuts. I'm talking about like eating burgers and French fries, like the pizza. And so this is very important to understand, because a lot of my patients come in after they eat pizza and they say, oh, that tomato sauce nearly killed me. And I'm like, my dear, it's not the tomato sauce. Do you remember how much cheese there was on that pizza? So basically, where people think it's the acid that's the problem, it's not the acid. Acid belongs in the stomach. We're supposed to have acid in the stomach. The problem is when things come up. So the lower esophageal sphincter needs to stay tight. And so we know that a high-fat diet, which is the standard American diet, which is like 60%, 60% fat, relaxes the esophageal sphincter. And so that's the most important thing to remember out of this whole thing: fat, high-fat foods. Oily foods, like if you went to an Italian restaurant and had fettuccine alfredo, that creamy sauce, that's going to kill you. It's just going to be terrible. So remember fatty foods. And I do want to emphasize that I'm not talking about whole fats, like, avocados and nuts and seeds. I'm talking about processed fats like cheese and disgusting oils, right? And I'm not talking about a little bit of olive oil on your salad. I'm talking about like making a really oily, fatty meal. So that's the biggest thing. The other things to consider is tobacco smoking. If you're smoking, stop smoking. That causes the lower esophageal sphincter to relax. Alcoholic beverages are another thing to consider. So if you have a pizza and a beer, good luck. You have to take that Zantac after all. I mean, I'm not suggesting that, but there's obesity is a huge factor. 45% of our country is overweight or obese. I mean, that's huge. It's like one of the most commonest diseases in the world now is obesity. So there is thought that when you're obese, the fat molecules produce these hormones like interleukins, TNF alpha, and all these other inflammatory hormones that relax the lower esophageal sphincter. This is a theory, but we don't know exactly why obesity does that. It could be the abdominal pressure. Who knows? It's a risk factor for GERD. So if you are obese, I would say lose that unwanted weight. Um, there are other factors, but they're not as strong. But this is the most important thing: is when you have reflux, you should practice these lifestyle modifications.
Yeah, I was gonna ask you, do you think the recommendation for why to avoid acidic foods is because possible inflammation that already exists from the stomach acid tearing away, some of that tissue? Could it just be that it's sensitive to the acidic foods, however, the acidic foods are not causing the GERD?
Exactly. So when I do endoscopies, I go into the esophagus and I go into the stomach and I'm looking, and you do notice I do notice that a lot of people have an inflamed stomach. And so what happens is when you have, let's just say you were taking gobs of Advil or aspirin or non-steroidal anti-inflammatories. A lot of women take those because of their cycles every day. A lot of older people take it for cardiovascular protection. They take aspirin every day. A lot of people, the elderly, oh my God, they take so much non-steroidals because of their joint pains, right? So these medicines, they prevent the production of prostaglandins in the stomach, and prostaglandins are responsible for healing the gut, constantly healing the gut and producing that mucus layer that's protective, right, in the stomach and the rest of the gut. So what happens is when you take these medicines, they prevent that production of the prostaglandins, and so you don't get that nice mucus layer. So that's why they cause leaky gut, and that's why they cause damage. That's why they cause ulcerations. They literally like kill that nice film that's supposed to be protective. So the defense of the stomach is gone. So there's tons and tons of inflammation suddenly, right? And then that acid can, at that point, be bothersome. So when you drink lemon juice or you could eat something citrusy, then you have problems. But normally, you and I can eat lemons. I can sit there and eat 5 or 6 limes or lemons. And it wouldn't bother my stomach, right? So normally we shouldn't have any problems with acid. It's when we have pathology in there, then suddenly the acid becomes a problem. For those people, it's actually a good idea to take some of these to take these proton pump inhibitors or H2 blocker medicines to heal the stomach, to have something to heal it first for a short period of time. Then you can tolerate all these good foods and then do the lifestyle modifications. I hate medicines, and I don't think that people should always, I'm just saying sometimes when you're stuck and you have no choice but to take it for a couple of months, then it may be a good idea. But yeah, I mean, that may be why citrusy foods can bother people's stomachs when the protective layer is gone.
Yeah, no, that totally makes sense for sure. And moving a little bit lower into the GI tract, because some people, actually a lot of people, bring up bloating and gassiness as a common problem. What causes that ultimately? Why do people get bloated and so gassy?
Yeah, good question. Good question. Actually, believe it or not, that is the number one complaint in my clinic as a GI is bloating and gas. And we were about 60 to 100 years ago, we used to say like, stop swallowing air. We actually blamed our patients for swallowing too much air. So we used to say, don't talk when you're eating,
Yeah, I've heard that
or be
before.
careful, right? It's crazy because oh, I remember growing up, my dad used to always tell me, you're not allowed to talk at the dinner table, which is sad because that's everyone's time to sit around and talk and be social. And it has actually, having a meal with your family is the most important time of the day at dinner usually. And actually sharing a meal with a friend and having a nice conversation is part of our culture. It's important. And so I was always like, man, this just does not make sense. Like, why would human evolution, be that way where, when we're eating, we can actually swallow air? It just doesn't make sense to me. It turns out that I was actually right. Even though I was a child, I always thought that that doesn't make sense. And then I was like, and despite what my father says, I always like talk a lot and I don't get bloated. So I always thought about
Right.
this whole thing doesn't make sense to me. And even in some GI books, you'll see, says don't. There is some truth to that. You do swallow a certain amount of air. However, it's not a big deal. It escapes your GI tract, diffuses, through the GI tract and out, and it doesn't usually become that excessive because you can't possibly swallow that much air, but it's excessive. But we have people who come in where they're okay in the morning, right? They haven't eaten anything, and then as soon as they eat, they blow up like a balloon. Some of them truly like look pregnant and get abdominal distension, and some have that feeling of it. Okay, bloating and distension. So bloating is like the most common complaint I get. That is usually due to a problem in the small intestine. As we're going down the GI tract, we're in the small intestine, right? Called small intestinal bacterial overgrowth, where you have an inoculation of colonic type bacteria, or you have too much bacteria in the small bowel where it doesn't really belong. So this over inoculation increases the number of bacteria that is supposed to be there or live there. And what happens is when you eat, you get fermentation of the food that you're eating. And you're supposed to get a lot of this fermentation, like 99% of the fermentation is supposed to happen in the colon. And when that happens in the colon, you pass the gas from down below, and it usually is not supposed to cause too much distension. You get flatulence, but you don't get distension and abdominal bloating. But for some reason, when the overgrowth is in the small intestine, people get super bloated and gassy, and they start burping and belching. And that usually causes GERD too, by the way. When you get that SIBO, it pushes the gases and pushes the stomach content into the esophagus. That's another cause of GERD, by the way. But still, going back to the small intestine, you have all this bacteria fermenting the food that you just ate, especially carbohydrates, right? And they produce gas, which is so many different types, like basically CO2, hydrogen. CO2 is also produced by our own cells, right? But they do produce CO2, they produce hydrogen, they produce methane, hydrogen sulfide, different types of gases. And these gases typically have a hard time going out from the bottom to come out of, it doesn't usually come out of the anus. It usually keeps getting trapped for some time into the small intestine, where people feel really uncomfortable because your intestines balloon and like just become distended. And then other times you burp it out, so it keeps coming up into your esophagus and comes out of your mouth. Some of it goes down after it passes through the small intestine, goes into the colon, and you have flatulence and pass gas and get it out. And some of it diffuses out of your intestine and it circulates in your blood, goes into your lungs, and you breathe it out. And that's why we have bad breath a lot of times, right? Where does bad breath come from, right? When you eat things,
That's interesting.
yeah, like imagine when you
I've
eat,
never thought of it that way.
yeah, of course, when you eat garlic and onions, right? Or you basically eat whatever that you eat. It's like you brush your teeth and you clean out what's on your tongue and your teeth. Why is it that the next day you smell like garlic? It's like comes out of your pores. Your sweat, you sweat it. It comes out of your breath because all of those gases travel outside of the small intestine into your blood, circulate, go into your lungs, and then you exhale that. And that's where people's breath smell. A lot of people have they have really bad breath, right? And they go to the dentist, and the dentist says, you don't have any cavities, you don't have any abscesses to think that this is an infection. A lot of that comes from the GI tract, you know. So anyhow, so small intestinal bacterial overgrowth is a disease that is very common and it's very much under recognized, and a lot of GI doctors don't even believe in it. I have patients coming to me suffering with bloating, gas, and they go to doctors who have said, "Yeah, we don't really believe in this disease." Well, get ready, folks. It exists, and I see a lot of it. I see a lot of it. And in the past, we used to call it IBS. Whatever we didn't understand, we'd call it IBS. Oh, it's IBS. But now we know that it's more than just IBS. I mean, these people have small intestinal bacterial overgrowth, and when you kill off that bacteria, they are well, and their IBS goes away, their bloating and gas goes away. So perhaps this is a separate disease, and it is a totally treatable disease, and we should respect it. I actually, I don't mean to plug this in, but I'm going to plug it in. I have a group, a SIBO group. If people who are listening have problems with their gut and they think they have SIBO and they have been diagnosed with SIBO, go on www.yourgutconnection.com. And I have two registered dietitians we have foods, recipes for people to follow and ways to treat their SIBO. And, my biggest pet peeve about SIBO is that now there are a lot of online platforms teaching people to eat a low fiber diet, because if you eat a low fiber diet, you're not going to have fermentation, right? And then you have less fermentation. You will still have fermentation, but you have less fermentation, and then you have less bloating, right? So let's just do that. Well, what do you think is the problem? Is it good to eat a low fiber diet? No, right? It's not at all a good diet. So what do we do? Typical American way of treating things. Well, let's just, since fiber is causing bloating, let's not eat the fiber. Since heart disease is killing you, let's put a stent in there. I mean, no one gets to the root cause, right? So that's the problem. So just because you have bloating, you shouldn't stop eating fiber. Because why is that a stupid idea? Well, I'm sorry, I'm being very frank about it, but is a stupid idea? Well, because it increases your risk of colon cancer. It increases, your risk of many other diseases, cholesterol, and heart disease. You need to eat a high fiber diet. It's good for your gut to eat a high fiber diet, because that's where prebiotic rich foods come from fiber. So then, so what should we do? Well, the answer is, well, and then by the way, people who do that, they go on this low FODMAP diet. They do eat the low fiber diet. Their bacteria, their ferocity goes down because they're not eating as much prebiotic rich foods, right? And they actually end up like getting sicker, and it's bad. So what you should do is get to the root cause. Why does one have SIBO? And you need to get to the root cause. And a lot of times it's because of hypothyroidism. A lot of times it's because of diabetes. A lot of times it's because they're taking some kind of a medication like omeprazole and Zantac that we're just talking about for reflux for long periods of time. Medications are a big cause. Eating disorders, Crohn's disease, ulcerative colitis, diverticulitis. Um, so I can go on and on. There are a lot of causes, and you should get to the root cause and find out. If you can find the root cause, get to the root cause and find out why they have it in the first place and treat that root cause. And then what you do is you basically start them on a certain level of fiber and then continue reintroducing fiber and get them used to eating all that fiber, but then kill the overgrowth of bacteria, whether it's with supplements or with antibiotics. You got to get rid of the overgrowth, because it doesn't just go away with diet anyway. So it's not a good idea to eat a low FODMAP diet for long periods of time and stay in that elimination mode for too long, because it's just going to hurt your gut in the long term. So in my group, we basically start people on a certain amount of fiber, which is, it's still full of prebiotic rich foods, and it's all whole food plant based. And then we slowly increase the fiber, where people over the 6 phases at some point end up being able to eat a ton of fiber and still have much less bloating and gas, and they get resolution of all their symptoms.
So, like you were saying before, there could be a number of causes that could be causing bloating and gassiness. I'm sure a lot of it is also from the food that people eat. Now, one thing I do notice after people do go vegan is they complain about bloating and gassiness. And I would think that somebody who's making a positive change, eating healthier, shouldn't be experiencing that. And I will admit, I've been vegan for almost 8 years now, and I do still experience bloating and gassiness, every now and then. So I'm just trying to put pieces together, and I'm sure you've heard of maybe cases too where vegans or people who are eating a whole food plant-based diet still experience bloating and gassiness, and what's going on
Well,
there?
yes, of course. I mean, first of all, it's almost impossible for someone to never have even a little bit of bloating and gas. It's normal to have bloating and gas sometimes because, first of all, if you eat a lot, you're going to have bloating because it's the physical distension of your stomach and your bowels because we tend to eat too much in this country, right? We go out to eat and then suddenly we have like a huge meal. And so that's the physical distension of the stomach and the bowels. Of course, you're supposed to have fermentation, so that gas can accumulate in the gut and further cause a little bit of bloating and distension. So it's not it's not pathology to have some bloating and gas and some distension once in a while. It does become a problem when it's to an extreme. For example, people wake up in the morning and they have a flat stomach, but let's say they have an orange or a banana, which is not a huge meal, and then suddenly they have so much bloat that it's out of proportion to what they ate. You know what I mean?
Yeah, definitely.
I'll tell you what, like last night, my mom made this Persian dish called gourmet sabzi, and it's full of red kidney beans and yummy vegetables, and it's like, and I ate like three big plates of it. I mean, I went to bed last night going, oh, I shouldn't have eaten that much. I'm
Nice.
not bloated. So it's not like I never get it. I get it too. But then again, this morning I had a banana, right? Nothing bad happened. I'm totally great. And so what we're talking about is it's not just a little bit of bloating. I mean, these people are extremely bloated and their belly feels tense. It's almost like it's not just because they have a little bit of gas, they get discomfort, cramping, pain. They feel even more bloated and their belly feels even larger than it really is. So there's something it has to do, in my opinion. I have this theory, it hasn't been proven yet, but it's I think that a lot of it has to do with the fact that these they have probably leaky gut or gut permeability, and what happens is these gases that are being produced are irritating the nerves of the GI tract or the nerves of the abdomen, and so it's more of a feeling that they get rather than the actual physical distension that becomes a problem. So we're at the embryonic stages of this disease, and we don't know much about it yet. But I can tell you that the more you avoid the fiber, the more you're gonna damage the gut because you need prebiotic-rich foods to heal the gut, and so it makes sense to not cut down on your fiber. It's just it makes sense to systematically and with help of professionals eat more fiber somehow to heal the gut.
Yeah, definitely. I mean, and again, you wouldn't want to get rid of the fiber. I mean, that would cause constipation, which is another GI problem. With the bloating and the gassiness, would you recommend people avoid foods like beans and broccoli if they are experiencing gassiness, or should they even take a probiotic to help? What are your thoughts on that?
Definitely not a probiotic. I mean, if someone has small intestinal bacterial overgrowth, probiotics actually may make it worse. I'm not big on probiotics. I don't even think people should take probiotics generally. Some patients in a study with ulcerative colitis, it showed that probiotics are beneficial. I don't believe in taking probiotics at all. I think that we don't have enough scientific evidence to make it good for everyone to take probiotics. This whole idea of probiotics for all doesn't make sense. And everybody has a unique bacterial or microbial flora in their gut. And if you could figure out how to individualize that to improve their flora, that may be one thing, but to throw a generic type of probiotics at people thinking, oh, that's going to fix your problems, that doesn't work. You can't do that. So in a study that was done in Israel about a couple of years ago, they showed that they eradicated the gut microbiome with antibiotics, and then one group got a fecal microbial transplant of their own stool after the antibiotic was finished. One group got probiotics, one group got nothing. The group that got the fecal microbial transplant did the best. The group that got nothing did better than the group that got probiotics.
Oh,
So,
wow.
so probiotics are not necessarily good for you, and it's a multi-billion-dollar industry, and it may make sense to someone that, well, I'm putting these good guys in there, and they're gonna go in there, and my gut's gonna make room for them. They're gonna sit there, live happily ever after, and they're gonna do all kinds of good things for me. Not true. It just doesn't work that way. We don't know whether they actually get inside the mucosa and live among the other organisms that are already there. Um, do you just defecate it out and you have expensive poop? Do they go in there and actually cause havoc and war with the resident gut microbiome there, where there's competition? Possibly. So for now, don't take probiotics until we have more information as far as how to actually customize these organisms. And everyone thinks that the gut microbiome consists of just bacteria. So what we swallow in a pill, a probiotic, is just bacteria. But there are other organisms that live there, like fungi, like protozoa, like archaea, and viruses. So you can't just take a large population of one of the microbiome residents and expect that you're going to achieve balance unless you found a way to eat all five. The viruses, the
Right.
protozoa, you're not going to achieve a balance there, and you need a balance. So until then, I think we should just, until we figure more out about the microbiome and how to make it help people taking probiotics.
Sure. Yeah, absolutely. And I'm sure prebiotics, aka fiber, is just as important. And people are thinking of doing the opposite of getting rid of the fiber, where the prebiotic, with my understanding, it feeds the bacteria that you already have.
Yeah, and that's key. That's exactly where people's focus should be. Eat more prebiotics. I'm not talking about supplements. I'm talking about eat fiber-rich foods. That's where you get prebiotics. Basically, it's fiber, and that feeds the microbiome that is already in your gut, and the healthy ones, because you can have basically you have healthy and unhealthy bacteria or organisms living in your gut. And fiber tends to give diversity to the good gut microbiome, tends to feed the good guys. So what you need to do is eat prebiotics in a form of food, not supplements, just food, and then a variety of it. And let your gut heal on its own. It's not overnight. I've met many people with gut diseases, and it tends to be a long process. We don't have a magic pill yet. You have to live a healthy life and stop drinking, stop smoking, start exercising, start eating healthy, and slowly the gut microbiome builds.
When somebody does first go vegan, though, would you say to gradually start adding fiber to their diet, like with the beans and like the heavy vegetables? Should people like just embrace them right away, or should they kind of like follow like some sort of step plan that, adds these foods slowly? Because that's what I've heard. I don't know if that's true or if it holds any value.
Well, I mean, you can't like, I don't know. It's variable. Like I went, I started eating a whole food plant-based diet overnight. Like I was eating vegetarian, but I was the biggest junk food vegetarian you've ever met. And literally overnight, I went whole food plant-based, and I had zero problems. I you know. And I meet people like that who are, who have no problems switching to a whole food plant-based diet and overnight without any bloating and gas and discomfort, maybe a little bit. But then I meet people who get extremely gassy and extremely bloated when they eat fiber, right? My own mother is like that, and she won't listen. So I'm not even going to help her because she's not listening. But anyway, but I have patients of mine who are, who need to gradually increase the fiber. So beans are difficult to digest because they're very high in fiber. So sometimes you should bring those into your diet at the very last. Start with a lot of fruits, eat a lot of fruits and potatoes, and like starchy vegetables. And they have a lot of prebiotics, but they don't really cause that much bloating. Sometimes the high fiber foods like legumes are just basically the last you should bring into your diet. And some people get really bloated with grains like quinoa and things like that. And I hear a lot of people get very bloated with vegetables, like raw vegetables, right? Because they're very difficult to digest. So those ones you should like. They did a study where they looked at people who don't eat a lot of fiber-rich foods and eat the standard American diet, and these people actually lack a certain gut microbiome. They actually lack a certain gut microbiome
Wow.
that can break down plant cellulose. Okay, you and I, we could eat a bowl of broccoli and everything's going to be fantastic. Maybe we'll have a little bit extra flatulence that day, but we're not going to get sick from it. But these people don't know their body has no ability to break down plant cellulose. That's real. There's actually a bacteria that does that.
Right.
So when they looked at this population of people who eat the standard American diet and they only get 10 grams of fiber. Can you imagine getting only 10 grams of fiber per day?
That's crazy.
That's right. They don't even eat raw vegetables. They simply don't have that bacteria that breaks down
Hmm.
plant cellulose. So what happens when they eat kale? What happens when they eat broccoli? I mean, imagine how sick these people will get. So for those people, now I'm thankful that even though I was a junk food vegetarian, I grew up eating a lot of vegetables. I still grew up eating a ton of fresh vegetables and salads, right? I didn't grow up eating spam and tuna sandwiches, so yeah, so but that has to come, that kind of microbiome has to come from somewhere, and it takes time to inoculate your gut with those bacteria that can break down the plant cellulose. It means literally surrounding yourself with people who are healthy. I tell people hang out with vegans because you share gut microbiome when you hang out with people. So slowly you re-inoculate that microbiome, and you can't just go take a probiotic and get it over with. It takes time, but you slowly re-inoculate your gut, and perhaps then you keep feeding that microbiome, and then the population just changes over time.
Gotcha. Yeah, and that support helps keeps you more on track. Everyone's motivated, everyone's eating the same thing. So yeah, a lot of benefits hanging out with people who are into the same lifestyle as you, eating healthy and being fit and all of that. I wanted to ask you a little bit more about some more serious, GI problems like when you talk about Crohn's disease or irritable bowel syndrome, even colon cancer, which is up there in the charts in terms of death. What can you say about the power of a plant-based diet when you're talking about more serious conditions like those?
Yes, absolutely. Thank you for asking that. So we're going down, we've just talked about the esophagus, the stomach, we've talked about the small bowel, and we're moving down to the colon, which is the large intestine. And what could go wrong in the large intestine? Well, inflammatory bowel disease and colon cancer are two big ones that we can talk about right now. Maybe we can skip by BS. It's like IBS is not a disease of the colon. It could be the disease of the entire intestine. So let's not talk about that for just a second here. But we're talking about colon cancer and inflammatory bowel disease. Two really big problems in the world right now. I see it all the time. Let's talk about colon cancer first. The second biggest cancer killer in both men and women in the United States. About 150,000 people will get diagnosed in 2020 with colon cancer. About 50,000 will die of colon cancer. In this country, we're doing a very poor job. In fact, it's March. March is Colon Cancer Awareness Month. We haven't been talking about colon cancer much this month because of the coronavirus, but colon cancer will kill more people this year than the coronavirus. So let's get real here. This is important. And so colon cancer is, guess, just take a wild guess here. I don't know, you may have known, but you may know this information, but guess what percent of colon cancer is actually genetic due to hereditary causes, and what percent is due to lifestyle? What do you think? Take a wild
Oh
guess.
gosh. I wouldn't know it, but just to take a guess, I would say maybe 10% is genetic.
Correct. 5 to 10% is hereditary, and the rest is due to environmental causes. Okay, so think about how important that information is, because most people, when they get sick and they have diseases, they think, well, my father was sick, so and my mom was sick, so let's just face it, I'm going to have these diseases. But when it comes to colon cancer, very very few of these cancers are actually due to genetics. So it turns out that we have some information that colon cancer has some risk factors, right? So if you have the genetic, I'm sorry, that is a bad thing. 5 to 10% of you, I'm sorry, 5 to 10% of these causes, I get it. There's really nothing you can do. You can be 15. Some of these hereditary polyposis syndromes, you're 15 and your colon is carpeted with polyps. There's really nothing you can do. You just have to be vigilant with regards to screening and see your doctor. This is important. But for the rest of you who don't have these hereditary causes, there are risk factors that cause colon cancer, and we have to know what these risk factors are. Number one, diet. Okay, a diet low in fiber has been, is a risk factor. So, furthermore, there are studies that show that people who eat a lot of red meat and processed meat are at a higher risk for colon cancer. So we don't know whether eating a lot of fish and poultry causes colon cancer. It hasn't really been tested, but we do know that when you look at populations of people who eat a lot of red meat and processed meat, they're at increased risk for colon cancer. So lifestyle, as far as nutritional lifestyle is really key in regards to preventing colon cancer. So if you're eating a lot of red meat, if you're eating processed meat, please eliminate processed meat out of your diet, like bacon and sausages and deli meats, because these have they have compounds that cause DNA mutations in your body. And the World Health Organization has said that they're group 1 carcinogens, meaning that they definitely, without a shadow of the doubt, they are definitely linked to colon cancer. And so it's like cigarette smoking, same thing, group 1 carcinogen. Stop doing that. If you're eating a lot of red meat, this is time to stop. It's time to eliminate that red meat out of your diet and try to incorporate more legumes or more tofu or tempeh or grains, fruits, vegetables, nuts, seeds into your diet, because red meat is associated with colon cancer. Not as strongly as processed meat, but still there's definitely a link, and we need more studies to identify that. Poultry and fish, they have never been actually associated, but they haven't really been studied very well either. So the jury's hung on that. We'll know. So low fiber diet, red meat and processed meat we talked about. Sedentary lifestyles. Okay, so Start moving, get movement, get outside, walk, hike, do something fun. Stop smoking, stop drinking alcohol. Drinking alcohol is also associated with colon cancer. And so these are some lifestyle modifications that you can make to not become a statistic and have colon cancer. This is important. Um, but besides the lifestyle modifications, it's very important that people participate in age-appropriate colon cancer screening. So it's not just about eating healthy. Even if you eat healthy, you should have colon cancer screening. Colonoscopy is one of them. There is also CT colonography, and there is stool testings that are available. Screening means nothing is going on. You don't have any abdominal pain. You don't have a change in the bowel habits. You don't have any blood in the stool. You're doing fine, but you're 45 and you need a screening. You can choose from those three modalities. If you have a family history of colon cancer, you should do it sooner. So talk to your doctor. It should be 10 years earlier than the person who had it, or age 40, whichever comes first. Okay, so that's really important. But a lot of people say, "Oh, I don't want to do a colonoscopy." Fine, there are other modalities to choose from. You can do a stool test out of your house. You can do a CT colonography. You can do a colonoscopy. You choose. I chose a colonoscopy because it's diagnostic and therapeutic, meaning that you go in there, you have polyps, the physician can cut them out right there, then and there. And I had 2 polyps, it's out. Unfortunately, with the Cologuard test, if you have it, then you have to have a colonoscopy after that. CT colonography, you get a lot of radiation. So I always discourage people out of doing that one. I encourage people to choose from colonoscopy and stool testing. Those are my favorite 2 modalities. But again, it's individualized. But if you eat healthy, right? You're eating healthy, you're exercising, you're not smoking, drinking, and doing all the bad stuff, and you're doing the age appropriate screening, it's almost impossible to die of colon cancer. And this disease should be the thing of the past. Like, no one should die of colon cancer anymore. Maybe very few people who are unfortunate. They're like 30, like I just scoped a 30-some-year-old with colon cancer. And he had blood in the stool, and so he came to me. It wasn't a screening test anymore, it was a diagnostic test. So as soon as you have pain, change in the bowel habits, and blood, it's not a screening, it's a diagnostic test. I did a colonoscopy, and this individual happened to have cancer. There's nothing this person could have done because, that person was vegan for like 6 years, but this colon cancer started like many years before the vegan diet was started. Most of us grow up eating hot dogs, right? So you get some of these cancers grow, like these polyps have been there for 10, 15 years, and they slowly grow, and then they become cancer in the last 6 years. And so even though this person was a vegan still, but what I'm saying is sometimes you can't totally prevent colon cancer because young people can get it too, and before age 45. But for the majority of the people, majority of the population, 99.9% of the time, if you eat healthy, avoid red meat, avoid processed meat, and exercise and don't drink and smoke, and lose weight if you're obese, and do this age screening colonoscopy, it's almost impossible to die of colon cancer.
Wow. And you hear about everybody talk about the severity of cancer, how important it is to have this fight against cancer. The number one, I think, form of cancer that leads to death is lung cancer, if I'm correct.
Correct.
And then the second one, like you mentioned, is colon cancer. So it blows my mind that, we talk about avoiding cigarettes. Obviously, there's a label on there, it causes cancer, warning clearly on there. But why are we not talking about this one that's like right behind it?
Totally. I mean, the vegan community is now talking about it, but we're like the only ones. It's interesting that people are serving bacon every day and sausages, and it's like, why are we not talking about it? I mean, how many more people should die before we wake up to the fact that people are dying of colon cancer, and it's preventable?
Absolutely, exactly. Yeah. So I'm really glad you tackle that and you speak up about it and the work that you do with your patients. Um, And then lastly on my list, moving through the GI tract, which is probably the most awkward one to talk about, but I feel like it's important because I still get questions about it. Hemorrhoids. I don't know if that is diet related at all. But what are your thoughts on
Yeah,
that?
before we talk about hemorrhoids, let's talk about inflammatory bowel disease really quick
Oh,
because we
yes.
skipped that. So, inflammatory bowel disease is basically a broad term used to distinguish basically a type of bowel disease where there is inflammation, and generally speaking, the body is attacking colon or the small bowel. And so there's inflammation, and it's basically almost like an autoimmune where your body is attacking itself, whether, and most of the time it's in the colon, but in the case of Crohn's disease, it's also in the small bowel. But inflammatory bowel disease can be ulcerative colitis, it could be Crohn's disease, or it could be microscopic colitis, right? These are all inflammatory types of bowel disease. And basically, inflammatory bowel disease means it's not infectious colitis, it's not caused by infection, it's due to inflammation, and it's not due to irritable bowel syndrome. It is literally okay. So now, ulcerative colitis is a disease where it's limited to the colon, and it affects the colon. Crohn's disease is a disease that mouth to anus, anywhere mouth to anus. It's usually in the small bowel and the large bowel, and it is a full thickness inflammation of the bowel. And basically, it is a very debilitating disease, and microscopic colitis is an inflammatory one that usually just occurs in the colon. Now, it's a very common problem in the United States, and the cases are rising. And there is some thought that so we know that genetics have something to do with it. We have isolated genetic risk factors. However, I believe that diet has more to do with it than genetics. And even if you have the genetics, you could possibly never have this disease if you play your cards right, sort of. You know, if you eat healthy. I see a lot of cases where kids are doing well, and then they go to college and they start eating hot dogs and burgers, and they get a flare up, and they usually think it's due to stress. I highly doubt that inflammatory bowel disease is due to stress. It usually flares up because people go to college and they start eating badly.
Yep.
And they start eating campus food, which is basically junk crap that doesn't belong in people's body.
Absolutely.
And and so basically these people get inflammation of the intestines, bleeding, diarrhea, weight loss, all kinds of bad things happen. And we know that, when you eat, for example, in the case of ulcerative colitis, we know dairy can make it worse. We know that sulfur containing amino acids could also cause it or make it worse. So, we definitely need more studies in regards to inflammatory bowel disease and treatment of inflammatory bowel disease and diet. This is important that we definitely need more studies, but, and not to oversimplify it, but diet has a lot to do with if whether or not people go into remission and whether or not people stay in remission. So in my experience, I've had a few patients go into complete remission with diet alone, but it's very important to know that most patients cannot just go into remission with diet alone, and they need some of these medications to induce remission, and then they can stay in remission if they are eating a whole food plant-based diet. And so that's what I do for a lot of my patients. So if you have, like, imagine, so a lot of people say, I just want to do it with diet, but they have to remember, look, diet does not normally induce remission. And so, I mean, there's always rare cases, but generally speaking, like, imagine your entire house is on fire and you go take one of those little tiny little red fire hydrants and trying to, like,
Yeah, sure.
put out the fire. You're not going to win. What do you really need? You need the fire department with those gigantic hoses, maybe a helicopter, to put out the remission. And then you ask questions. Well, how did I get this fire in the first place? Let's fix the gas leak, and then I don't get fire problems again and again. It's the same thing with inflammatory bowel disease. When your entire colon is on fire, you can't go like, I'm just going to eat some lettuce and tomatoes and whole families. And oftentimes you need an induction of reduction with some of these big guns like steroids. Okay, that's what I tend to use. I put people into remission over a short period of time in a quick way, and then I keep them on a whole food plant-based diet because now we've stopped the gas leak, and let's see what happens. And some of them never get inflamed again. They stay in remission with the whole food plant-based diet. Some of them do get inflamed again. Then we know, okay, we've got to use something else, and then let's keep on this whole food plant-based diet. Let's see, we use a medicine, and then we keep them on a whole food plant-based diet. Let's say they flare again. Okay, then we need to step up the therapy and do something else. But generally speaking, if people listen and they do their card, they play their cards right, and we induce remission right away. Don't go for years with inflammation. It's purely a stupid thing to do because you keep destroying your gut even more and more. You keep breaking down these tight junctions and you get more and more inflamed. Instead, hit it hard, so to speak. You hit it hard, you induce remission, then you chill. Then like, let's see what happens with a whole food plant-based diet. If you need to, you step up the therapy. But if you don't need to, you don't. And the majority of the time, I hit it really hard. I induced a remission, kind of like the firefighters with the helicopter. And then we chill on a whole food plant-based diet. And I've had great success with that. We need more randomized control studies to prove what I'm doing is great and the right thing to do. But in the meanwhile, in my patient population who are very diehard about integrative medicine and holistic therapies and not using medicines, we've been doing fantastic, keeping in remission with a whole food plant-based diet. It explains everything because if you think about it, when you're eating a whole food plant-based diet, you're eating fiber-rich foods that create the short-chain fatty acids that heal the gut, decrease inflammation, heal the tight junctions between the cells, and decrease inflammation. It makes sense, right?
Sure.
So if you have a doctor who says IBD has nothing to do with diet, you may want to change doctors, just
Yeah.
say.
Turn around and run.
Turn around and run.
Yeah. But that's a great analogy. I really like that. That a problem might seem like a little bit of a spark in the beginning and you don't give it an eye, and all of a sudden one day you have a wildfire. And that's when,
Yes,
you're panicking and you're not thinking back to when it was such a small problem, you could have easily prevented it. But, I'm still amazed at what this diet can do even when the problem is big. Even when you have gotten to a
absolutely.
stage like colon cancer, that it still has, potential to help you even at that later stage.
Oh yeah, absolutely. A lot of even colon cancer can be completely treated and eradicated if you catch it in time. So if you catch it in stage 1, 2, it has a very favorable prognosis rather than waiting till it's stage 4. So we didn't talk about this, but I do want to quickly talk about it. Screening starts at age 45, but remember, if you have a family history, it starts sooner. But if you don't have a family history, remember, if you have a change in the bowel habits, abdominal pain, and blood in the stool, you've got to go to the doctor and ask, because a lot of 30-year-olds, I mean, like I said, I've had 3 or 4 recently, people diagnosed in their young years, and they had bleeding as their first sign. And so we'll talk about hemorrhoids in a second, but a lot of times people have bleeding and they think it's hemorrhoids, and it's not hemorrhoids. It could be polyps. And if you catch them early, you can get rid of them. So when it comes to hemorrhoids, we have the anus is a really bad design, by the way. Let me just tell you that right off the bat. The anus is a really bad design because it's this area at the end of the colon. After you pass you go into the cecum, ascending colon, transverse colon, descending colon, sigmoid colon, and rectum, and then there's something called the dentate line at the bottom that separates the colon from the anus. And the anus is basically kind of like my hand here. This is the same thing around the sphincter, right? On the outside of the sphincter.
Just like regular skin.
It's just regular skin. That's why it can be very painful when you have hemorrhoids, right? So it's the anus part has regular skin, and then there's a dentate line, which is just basically a line that separates the rectum and the anus. So above the dentate line, you have vessels, and when they get engorged and basically abnormal, it's called the internal hemorrhoids. You can't see them, you can't feel them, but they're there. In outside of the dentate line, below the dentate line, when you also have blood vessels who can get engorged and enlarged, and those are called external hemorrhoids. Okay, and within the anal canal, there is also pathology that can happen, which are called fissures. Fissures are these cuts, like a paper cut on your skin. Imagine having
Yeah,
that in your
ouch.
anus because you have constipation and you go to have a bowel movement and it cuts through and it goes deep into the muscle, and those are so painful. So if you have a super painful anus, anal canal, and where it's like you want to, like, it's like childbirth when you're having a bowel movement, that's a fissure, that's not hemorrhoids. Those are super painful. And like when you go to do an anal exam, as soon as you put your finger there, people are about to like die in pain. That's a fissure. So I stopped the exam right there. I'm like, no, this is a fissure, let's treat it. So these are deep cuts, and a lot of people get it because of constipation, the good old American diet, standard American diet, because people eat very little fiber. And once you get that cut, good luck healing it. When I was young, I got a fissure and it took me 15 years to heal it. I used to eat McDonald's. I used to work at McDonald's and I used to eat McDonald's all the time, you know. But, basically it's low fiber diets and people who are constipated, which is very, 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 very common, right? So what you have to do is start eating a ton of plants and avoid meat, dairy, and eggs, and just eat a ton of plants and eat a high fiber, like a fiber supplement, to make sure your stool looks like a type 4 stool on the Bristol scale stool chart, which looks like a sausage. This is the only sausage you should have in your life. Your poop
Right.
should look like a sausage.
Right, right.
Or a banana, or it should look like a basically long log, like a,
Mm-hmm.
basically formed stool
Right.
without cracks, and that's a normal stool. So basically, it should not require a lot of straining. It should come out easily, and it should basically, it could come once a day, a couple of times a day, could come once every 3 days. But when it comes out, it should not require training and it should look normal. So anyway, if you don't have that and you have a fissure, please achieve that because it's really important, because every time you have a bowel movement, that anal canal rips again and the fissure doesn't heal. And you need a medicine called nitroglycerin that you insert in there like 4 times a day. And you have to put your finger deep into the canal to insert the medicine. Ask your doctor for that. So then forget the fissures for right now for a second. What else could happen? Internal hemorrhoids or external hemorrhoids. Internal hemorrhoids do not have any, you don't have pain with them. They bleed, they generally bleed a lot, and they could come out of the anus and hang out, and they could go back in. But generally speaking, blood is the most common uh, way that they manifest. Again, you need to avoid constipation, eat a high fiber diet. That's the treatment. Sometimes they don't go away with that, so you have to put bands on them to eradicate them, but they can come back again if you're not careful. External hemorrhoids are also dilated blood vessels of the external sphincter. They're very painful. And sometimes they itch a lot too. They get itchy and they get painful. And sometimes they can get, a blood clot can get stuck in them. And so you can get an external hemorrhoid thrombosis. And literally, it's the most painful thing in the world, where you have to go to the emergency room or see a colorectal surgeon, where they cut it and they evacuate the blood clot. So that's how you treat those.
Ouch. It doesn't sound fun at all.
It's not.
Yeah, yeah. Wow. So it sounds like some of the bad diet, like a McDonald's diet, a standard American diet, right? That can cause some of the straining, because of the low fiber, and your poop's not, like you said, like a sausage or a banana. It's more, I would imagine, like little pellets and like other stuff that people normally report. But have you noticed that switching to a plant-based diet can help some of those issues, or is that something that you should just seek medical attention with?
Well, many times, if you have hemorrhoids, it's not going to kill you. So relax, it's fine. A lot of people have them. So start eating a high fiber diet and go to the grocery store and buy a fiber supplement and start taking the fiber supplement and stop eating meat, dairy, and eggs and eat a whole food plant-based diet and see what happens. The only time it's an emergency if it's a thrombosed external hemorrhoid where it's extremely painful and it's basically like it's unbearable. You should go see a doctor. And if you have a very painful fissure, you should see a doctor. But if it's just hemorrhoids and you have a little bit of blood and a little bit of stuff bulging out and it's not really painful and it's not an emergency, you could totally treat it at home with some over-the-counter preparation H medicines and things like that and eat a ton of fiber. And believe me, most of the time when people come to me with hemorrhoids, that's what I tell them because 99% of the times it's not even an emergency. It's just something they could have treated at home. So, but when people have blood in the stool or blood in the toilet or on the napkin, sometimes they think it's a hemorrhoid and then it's not. So if you have blood, you need to consult with a doctor. If you think it's a hemorrhoid, eat a high fiber diet, and perhaps that could be treated.
Gotcha. So yeah, wow. What a journey. I mean, we went from like throughout the whole GI tract,
Mouth to
and
anus, we traveled.
yeah, learned so much. I wanted to ask you, this is my last question here. For someone who has an altered GI tract, maybe they've had weight loss surgery, they have a smaller stomach now or a complete bypass. In what ways would you say that they should alter their diet, if any way? Should they eat less fiber, just less meals, smaller meals but more frequent? What are your thoughts on that?
So that's a very good question. Um, Initially, right after surgery, they have to follow the recommendations of their surgeon because immediately after surgery, the anatomy is altered and it needs to heal. But I get patients post-gastric bypass all the time, and they've been, if they're not in the immediate post-op situation, but they're just basically a normal person now, just have to eat and drink. And you could also talk to my friend, an incredible physician, Dr. Garth Davis, who is a bariatric surgeon, and I believe he would agree with me that. And I'm the GI gastroenterologist. He's a GI surgeon. So if you think about it, two different worlds, but we would probably agree that eating a whole food plant-based diet is absolutely beneficial for people who post bariatric surgery because number one, you don't want them to gain the weight back, right? Most of the people who get bariatric surgeries because they have diseases that would otherwise kill them, like they're 400 pounds and they could die if they don't lose the weight, and they have diabetes and high cholesterol and hypertension and they can't walk because of their joints, and they're at a point where they've basically hit rock bottom because of their obesity, and they would die if they didn't get the surgery. So we would do surgery on them. I don't, but a bariatric surgeon would. But then what's the most important thing is to make sure that they don't they don't become overweight again or obese again, right? Isn't that the goal? The surgery helps you lose weight, but if you don't watch what you eat, you will gain the weight back again. And this happens a lot, actually. Why? Because a lot of these bariatric surgeons are not as smart as my friend Dr. Garth Davis, and they would tell them, eat a high protein, high fat keto diet, right? They put them on keto diets. And so these people will die of heart disease, they'll die of they gain the weight back, they'll get diabetes again, it all comes back. So the most important thing is to make sure that after this very cumbersome, difficult surgery where you're altering someone's anatomy, that you make sure that they don't gain the weight back again, right? I mean, this is important, and people don't emphasize on this enough. I mean, Dr. Garth Davis does. So he puts people on a whole food plant-based diet. I do too. I say eat a whole food plant-based diet so you don't gain the weight back. And also, it's important to eat a whole food plant-based diet, even if you've had altered anatomy, to make sure that you have a healthy gut, a healthy heart, a healthy pancreas, a healthy metabolism. It really doesn't make a difference, you know. Some of these people are at higher risk for some vitamin deficiencies because of the bypass. So you have to be conscious of that. For example, they become iron deficient. So you have to make sure that they take certain supplements. So it's a little bit different than if you have a normal gut. But these people basically hit rock bottom. They had to get this surgery done, and here we are now. So then they have to take certain supplements that you and I normally wouldn't have to. But when it comes to the diet, it's the same diet. Yeah.
Yeah, and I'm glad we talked about that because it's, we talk about, eating a whole food plant-based diet, and then, you have people like that who reach out to me. I'm sure they reach out to you as well, who kind of feel a little isolated and have those extra concerns of, can I get enough iron and other things that they might not be absorbing because they are missing, or the food rather is not going through that certain body part.
Exactly. The duodenum is bypassed. So a lot of times, the duodenum is what extracts certain nutrients, micronutrients like iron, vitamin D, vitamin K. They usually go through the duodenum. So if that part of the GI tract is bypassed, you could potentially become nutritionally deficient in regards to those certain micronutrients. Um, and look, no one ever thinks that the gastric bypass should be anybody's first choice. Okay, even the bariatric surgeons would tell you that. But if you have had it and you have to have it, please make sure that you eat healthier than the normal people with the normal GI tract. Because I mean, I see so much iron deficiency in people who don't have they have doctors who don't understand nutrition. I mean, even if you have to get the surgery, go to Dr. Garth Davis or someone who understands nutrition. It's really important. A lot of times, some of these surgeons, they do the surgery and they're like, goodbye. Now I'm not going to make any more money off of you. So, I don't want to have anything to do with you. And so these people go to nutritionists and dietitians who don't understand nutrition. They go to doctors, GI doctors who don't understand nutrition, and they're followed by these individuals who end up actually not helping them very well. So it's very important. And unfortunately, with the rate we're going to have more and more gastric bypass patients. We're going to have a ton of people who end up getting the surgery done. And it saddens me because people should lose weight with diet and lifestyle modifications. But we're going to have a ton of these people who get to that point where they can't even walk anymore.
Mm-hmm.
And then surgery is risk-benefit ratio is such that surgery is indicated, right? And they have really good data in the surgery world that these people actually end up doing okay.
Yeah,
So we have to go with evidence-based medicine. And it's
sure.
unfortunate because I'm sure all of those surgeons would rather have those patients lose weight with diet. But the reality of it is that it does. And a lot of these patients are uneducated. They don't understand nutrition. They're lower socioeconomical status. They can't afford fruits and vegetables. It's a big problem. Let's face it. It's a big problem because our stupid government subsidizes the wrong shit. They subsidize meat and dairy instead of subsidizing the fruits, vegetables, nuts, seeds, and grains, right? As long as we have this oblivious government subsidizing the wrong stuff, we're going to have problems like that. And then to obliterate. So you understand, like we are not getting to the root cause, but we have a problem in our hand that this person's going to die. They can't even get out of the room, out of the house. Someone has to go grocery shop for them and bring them food to eat because they can't even get out of bed. So they get these bypass surgery, but we're going to have more and more of that, right? Because we're not getting the root. How do I know? Am I a magician or do I have a crystal ball? No, but I know how America is eating.
Oh, yeah.
So how could we not think that we're going to have more gastric bypass patients? We are going to. So, but then the question is, how do we, so as dietitians, nutritionists, you're a nutritionist, get ready, learn how to treat gastric bypass patients.
trying to keep my mind open, right? Learn about as many topics as I can because it's not as simple as just telling somebody to eat plant-based. I mean, it's going to help you regardless of what you're suffering from what it sounds like, but there are so many like little details that make things a little bit more complicated than they are. But regardless, we're on a good track here promoting this diet. And like you said, people are going to continue becoming overweight and obese. It's going to keep getting worse. If you compare, from a decade ago, each year, the obesity numbers, like those maps, you see those colorful maps
Hmm.
that change from blue to red or whatever it is, and you see obesity just getting more and more prevalent. It's incredibly sad.
It's a bigger problem than the coronavirus, for sure.
Mhm. Absolutely. Yep. So I'm really glad about the work that you're doing, Dr. Sadeghi. I want more people to reach out to you if they can, because we covered a lot, but I'm sure there's a lot more that goes into GI health. So if
Yes.
people want to get in touch with
I do
you,
want to, I'm very active on Instagram, so follow me on Instagram, Angie.Sadeghi. But I cannot give medical advice on Instagram, but I'm available for nationally and internationally to treat people. I'm sorry, not treat. So I'm available for telehealth, telemedicine. So you basically get on your laptop or phone with a camera and we can have a video chat. And in order to schedule an appointment, if you're in California, I can be your doctor and I can treat you and give you medications. But my license is from California, but I don't have an out of state, I don't have any other licenses. I only have a California license. So if you're from out of state, I'm available for coaching. And what I usually do is I work with your doctor. So you have a GI, I just coach you. So it's a coaching. It's basically what I can help you say, okay, you need this, you need that, and then talk to your doctor, ask for this, ask for that. So if you have inflammatory bowel disease, I can be very helpful. If you have SIBO, I can be very helpful. If you have IBS, GERD, all of that stuff, I can totally coach you through this. Then you can call me 949-404-4444. So it's 949-404-4444, or you can go on my website, www.drangiehealth.com, DRANGIE health.com, and schedule an appointment, telemedicine appointment.
awesome stuff. Well, I'll definitely have all of that in the show notes below so people can easily click on that and refer to that to find out all the information regarding about the work that you're doing. But hey, thank you so much for coming on the show and spending all this time talking about all this great stuff. So if you ever want to come on again, you're
Oh,
more
I
than
would love to.
welcome.
I really enjoyed talking to you. You're a sweetheart.
Oh,
And
thank you.
quite knowledgeable and had wonderful questions. I hope more and more people watch your show because it sounds like you're doing great work and talking to all the knowledgeable people out there and getting the word out. um, I would love to also include this show on my Instagram, so let me know when it's available,
Oh,
please.
absolutely. I definitely will. Well, thanks so much. Stay safe with this whole coronavirus thing. We'll all be keeping an eye on it and, practice that social distancing.
That's right, exactly.
All right, Dr. Siddiqui. Well, thank you so much. You have a great day and we'll talk soon.